This is your program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to providing lasting solutions. I am your regular anchor, Ushomowa Daniels. Our focus this week is on renal disease. Many Nigerians are coming down with kidney failure. We shall be telling you the causes of the disease and workable solutions. Let's bring you reports that made news in the last 1 week before we continue.
I have brought my car for full body work.
Madam, look, we will shine this car.
Wait. This cough doesn't sound good at all. What are you doing about it?
Oga doesn't want to go to the hospital so that they won't say he has COVID-19.
No, now. Cough is a sign of different infections, including tuberculosis. You would only know which cough it is if you go for testing.
Kai, I've been coughing for more than 2 weeks now.
There's no need to fear. I have done this test myself. To know the right treatment for the particular cough you have, you must first get tested.
Oga Chekamo, make you dey sure because
who no go, no go, no.
Check that cough for tuberculosis.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
We don't have monkeypox in Lasuth. That report was fake. The signatory, we found him and we questioned him, and he said he never wrote such a report. Yes, about 4 weeks ago, there was a case that looked like monkeypox. That was an orthopedic case, and we ran tests. We did all the precautionary measures, and it turned out not to be positive at the end of the day.
This clarification on the true situation of monkeypox and other disease conditions in Lagos State has become necessary to avoid the panic that could result to more problems, often associated with misinformation. The government representatives here also raised alarm over the increasing number of patients present at the health facility with renal diseases, especially kidney stones. The commissioner, however, disclosed plans by the government to solve the problem.
Often in this environment, because of the heat, a lot of people don't drink enough water, and so kidney stones form. So what we have here is a machine that can remove those stones without major operation. So it's a major breakthrough for us. It's the first of its kind in one of our public health hospitals. And we're very grateful to the donor, Honorable Obasa Idowu Obasa, for this very kind and thoughtful gesture to Lagos State.
It's an equipment that can, without any surgical operation, break down stones anywhere in the body. It's very costly. We couldn't afford it. So we went to an arrangement with a private company that would bring it to us. We would pay money and use it on the patients. But then it got spoiled. The equipment belonging to the private company got spoiled. And we were no longer able to do the procedure on patients. And so that was when Honorable Idowu Obasa came to our aid, and he procured the equipment for us. And so we own it now. And in fact, the pricing, the fee for using the equipment will become much, much cheaper because we don't have to pay any rental fee to any private company again.
I traveled to India in 2009 for precisely this procedure. You understand? So as the professor was lamenting about this, I remembered my own trip to India and how God used that machine to help me with my kidney stones. So the third question was, okay, was I willing to do it? I can confess to you that at the time I said I was willing to do it, I didn't even know the price. You understand? But I trusted God that whatever the price would be, He will help me to get it. Do you understand? Of course, I was hoping that it wasn't expensive. You understand? And expensive is a relative word. The important thing is that God wanted it to happen, and it happened. They have a clear vision of what they want to do, which is very important, and they are committed to it. But you see, there's always room for improvement.
Beyond the challenge of inadequate equipment to manage patients, the mass exodus of medical personnel out of the country on a regular basis also came up for discussion.
Gender-based violence, according to some human rights advocates, is the most oppressive forms of gender inequality, posing a fundamental barrier to the equal participation of women and men in the social, economic, and political space. Gender violence includes intimate partner violence, sexual exploitation, female genital mutilation, and lots more. Nigeria, in the last few years, especially after the COVID-19 lockdown, has continued to witness unprecedented cases of gender violence with attendant consequences, including death of victims. It is to find a lasting solution that Titilayo Ogubambi came up with this book, Emerge.
Emerge contains true stories of survivors of gender-based violence. It doesn't end in just stories, it also provides strategies and recommendations that we can use in our community to curb the menace of gender-based violence.
From the perspective of the book, I think the book tells us a lot of, it's telling us our reality of what is happening in our society, in our homes, and how people are trying to navigate to solve the problem. I think everything still boils down to prevention and also boils down to people who have been abused getting justice. Until we understand that we can get justice at any form, then every one of us will emerge as survivors of this, because in one form or the other, we are all abused.
I'm so passionate about everything that concerns women. We are all conversant about the recent happening of rape, violence against women, genital mutilation, and I think by coming here, I'll get some of this book and take it to Plateau State to put a stop to it. It will go a long way in our society.
The forum also provided an opportunity to examine the root cause of SGBV with a call to parents on raising responsible children.
Gender-based violence in Nigeria and in most parts of the world has remained a big concern to every reasonable human being. We need to deal with it with basic education. We need to educate the girl child on the mindsets that will put them in a proper position to resist violence. We also need to educate the male child to be a husband, to be a father, and to be a responsible citizen of a country. Without proper upbringing, without proper incisive education that prepare children to grow up to be responsible adults who will not unleash violence on the other partner, it's very essential. So we must address it from the foundation, which deals with education, child upbringing, and societal outlook to all of these issues.
I read that book and I would say it's a must read for everyone, male, female. You wouldn't stop reading it. I started, it was more of just trying to get a goodwill message for today, and I couldn't stop reading. I read all the pages, and there were things I didn't know that I know now. It's an eye-opener, honestly. There are parts of the book that talks about the kind of violence that women face I didn't even know was violence. A parent would be meting that out on the child, and you would think it's normal. But after reading this book, it would open your eyes truly to what really are the causes and what really are terms or forms of gender-based violence that we should look at today.
It's available, it's accessible, it's affordable, and it's acceptable.
Levinus Emeronye is a pharmacist who believes in the efficacy of traditional medicine. Traditional medicine refers to health practices and beliefs incorporating plants, animal and mineral-based medicines, spiritual therapies, and manual technique to promote well-being. Before the advent of modern medicine, many Nigerians relied on it to diagnose, prevent, and treat diseases. Despite the recognition of traditional medicine in treatment, it has not been given its pride of place when compared to other countries. The 2022 African Traditional Medicine Day theme, 2 decades of African traditional medicine, progress towards achieving universal health coverage in Africa, has again reignite calls for a critical look on integrating the traditional medicine practice into the nation's healthcare system.
For example, in Ghana, I think more than 10-15 years now that traditional medicine department has been created in some of their teaching hospitals. And they work hand in hand with the orthodox medical practitioners. What it requires to bring them into the mainstream is for them to go through toxicological studies to determine if they can damage or cause damage to the body, the efficacy or effectiveness, whether indeed it can do exactly what people say it does.
It should be integrated. In fact, it is the best thing that can happen. Whether we integrate it legally or otherwise, it's already in the system. Over 85% of every Nigerian or humanity at large, in fact, over 85% of the world population use natural medicine.
So they should try and submit their products for testing. Our own is just to make sure that it's safe for consumption. We know we cannot stop people from taking this herbal medicine, but we want it to be safe. Once it's safe for consumption, then we are very, very good with it.
African Traditional Medicine Day is marked 31st of August every year to promote the important role of the continent's rich biodiversity of medicinal plants and herbs in improving well-being. Posture, according to health experts, is how you hold your body. There are 2 types of posture. Dynamic posture, which has to do with how you hold yourself when walking, running, or bending. There is also the static posture, which has to do with how you hold yourself when sitting, standing, or sleeping. According to the experts, there is a posture for every human activity, and ignorance about this fact has resulted to a lot of health challenges like joint and spinal cord problems.
We need to know how to walk. We need to know how to sleep. We need to know how to sit down properly. We need to know so many things so that we can get well. We know that our staff, they need to keep fit if they are going to be useful at all. And if you are going to take care of patients, you must also keep fit. Keeping fit does not mean that you are sick. Keeping fit means that it's about your quality of life. If you sit down for 2, 3, 4 hours at work, there's tendency for you that you are going to have some issues. And that is the reason why the physiotherapy department in you was called upon to come and give this lecture so that we can know how to walk and walk properly, when to sleep and how to sleep. And also, when you are in your place of work, what are those things that you need to do and you don't need to do. And there are some things that we all assume that we know the normal way to sit down until I'm sure many of you had the lecture today.
Close to 2 decades I've been practicing physiotherapy. I observed for all this period that majority of the cases that I see in the clinic, majority due to postural syndrome. Well, we can term it in many ways. Some will come and say they have lumbar spondylosis, some will say they have cervical, some will say they have low back pain. But by the time we do the assessment, we will discover at the end of the day that majority of their presentation, the underlying cause is postural problem. And we can link this to inadequate knowledge about good and healthy postural practice. At the end of the day, they end up in biomechanical malalignment and reduced quality of life, reduced productivity. And when you have that type of life, you are not happy. You keep spending money and you are not happy. You are not healthy. So that is why we now look at if we are working in the hospital and you don't have this knowledge until you retire, then it means you have lost so much. Because at the end of the day, you retire and you still come and be paying money for your health.
My advice is that people be intentional about how they they position themselves while performing tasks, both at work and at home. Because at the clinic for some time now, we've been seeing so many people coming down with a lot of problems on their spine, on their joints, early onset. Before now, it used to be very elderly people who had really used their body, but now we're having younger persons coming down with a lot of problems. So this triggered our interest in the topic.
Making a deliberate effort to practice good postural habits will not only help you stay healthy, but help to promote productivity at work.
Good postural practice, you are able to prevent a lot of problems that can emanate from your being in active public service and even after retirement. Because our posture is attached to everything we do in life.
Former Emir of Kano, Mohammed Sanusi Lamido, and some key players in the nation's health sector have called for renewed commitments to primary health care, malnutrition, and professional satisfaction to put the nation on the path of recovery. Speaking at a forum in Lagos with the theme Nigeria Healthcare System, the Past, Present and the Future, to honor Nigeria's First Minister of Health, Moses Majeko Dumi, these players noted that since the 80s, there has been a gradual erosion of the quality of care, which must be arrested.
We're not investing in science, we're not investing in technology. What are our priorities? Malnutrition, you have parts of this country where you have chronic malnutrition of more than 50% of the children. The reality is, a child that is malnourished in the first 1,000 days is already gone. That child will never be a medical doctor, a computer scientist. The brains have gone. And we don't understand the impact of malnutrition on the human capital in this country. And it is one of the, in fact, we have all this high infant mortality rate that Professor Abidu mentioned. 60% of it is not health, it's malnutrition.
One of the main areas that we need to improve is in training. We need to train more people. And not only training them, we need to retain them. One of the ways we retain them is by giving them professional and personal satisfaction in the country. I don't think many Nigerians want to travel abroad. They travel abroad out of necessity. And if we can try to arrest that by giving professional satisfaction, personal satisfaction, and also give them the opportunity to develop professional development. That means better infrastructures and better training. I think we can arrest the brain drain.
Now that climate change is having such a negative impact, I know that if he was around, he would also be at the forefront of ensuring we took far better care of our environment, which is, after all, our ecological life support system, from whence every ingredient for the perpetuation of our lives emanates in a sustainable manner.
I also commend a rare phenomenon, something we seldom see in Nigeria. That is the transgenerational transfer of leadership and visionary skills from one, when many times you see somebody who's great, the offsprings fall flat. But the humanitarian clan has continued to be at the vanguard of progress, visionary leadership, and the promotion of healthcare in Nigeria. The Honorable Minister says the Federal Ministry of Health will eagerly await the outcome of today's deliberations so as in ways that they can inform policies at the ministry.
The issue of piling external debts and inflation, which has affected the cost of healthcare, also came to the fore.
18% inflation means the price of everything on the average doubles every 4 years, and that's what we've had. A bag of rice that was 80,000 naira in 2015 is 35,000 naira now, 4 times in 8 years. By how much are doctors' salaries increasing? By how much are teachers' salaries increasing? I mean, people want to serve, but they want to eat. They want to educate their children. They're human beings, they have basic responsibility.
The prevailing national economic challenges and poverty, according to them, have contributed majorly to the decline in life expectancy of Nigerians, now put at 55.
Tuberculosis is an infectious disease caused by germs. The bacteria is spread through the air and transmitted from one person to another. Tuberculosis affects the lungs and other organs of the body. According to figures from the World Health Organization, an estimated 18 people die per hour of TB-related disease in Nigeria, which implies 432 persons every day and 156,000 every year.
It's the second highest infectious disease after COVID-19, and it's been with us for a long time. But unfortunately, it's not something that is common in some of the developed world. So that's why we need to, take our own destiny to our hands, right? And we need to be able to deal with it and not waiting for other people to deal with it, for us. So what my role will entail now, it's a lot of advocacy, it's a lot of collaboration, but also ensuring that even for us as a government, we use ourselves as an example. And what do I mean? Let's increase our budgetary intervention directly for TB control and see eventually, like I did mention, if we can build, an African infectious disease, research center. These are some of the things that we need to do long term to be able to put pay, to diseases like this.
We welcome this consortium and the information they're bringing to us from other parts of the world, some ideas, new ideas. We're going to incorporate that into our message and into our action plan for tuberculosis in Lagos. Yes, there are a number of missing cases. There are missing cases all over the world. There are about 3 million missing cases across the globe. And what a missing case is somebody who has tuberculosis who has not yet been diagnosed. And that happens because tuberculosis is a chronic disease. You can have TB for months or even years and not even know or present yourself to a doctor.
The quest to find a lasting solution to this TB challenge informed this gathering of stakeholders to deliberate on strategies and increase domestic funding to end the disease.
I feel very delighted having the Mr. Governor here, the Executive Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu, and his commitment to lead the effort to end TB, not only in Lagos State and Nigeria, but also in Africa, as the new title conferred on him, the PIGS. That for me, it's a great moment. It's an history that we have made.
The moment you cough and have a bit of fever, a lot of people these days think, oh my God, it's COVID. Keep in mind that it can be tuberculosis as well.
Each adult that has TB that is not recognized has the potential to infect 15 people. When it comes to children, because of their vulnerability, that person that can infect 15 adults may have a potential to infect many more. It contributes a lot to under 5 mortality.
Tuberculosis is curable. Diagnosis and treatment of tuberculosis is free. Early diagnosis and placing the people on treatment is a sure way towards ending the menace of tuberculosis in the country. People should not be stigmatized upon because that is what drives tuberculosis under the carpet. And people die in the villages, in their homes, and they are not captured.
Out of the $373 million needed for TB control in Nigeria in 2020, only 31% was available to implementers, with 7% from domestic and 24% donor funds.
The African Union and the World Health Organization, WHO, have called for immediate and comprehensive measures to end the significant toll of tuberculosis among children in Africa. With the intention to end childhood tuberculosis by 2030, they called for swift measures to accelerate recovery from the impact of COVID-19 as countries facilitate the scale-up of child-friendly tuberculosis diagnosis, treatment, and care. According to Mashidiso Mueti, WHO Regional Director for Africa, the call is aimed at galvanizing action and ensuring no child in Africa is lost to a disease which in many parts of the world is now history. He called on partners to be committed and united to ensure that an airborne disease hundreds of years old like TB is not a threat for the generations to come. The federal government has introduced the rotavirus vaccine into routine immunization to protect against rotavirus infections among children in the country. The Minister of Health, Osage Enahire, said improving children's health is a priority and called on parents to leverage on this privilege and ensure that their children are vaccinated against all vaccine-preventable diseases. The Executive Director, National Primary Healthcare Development Agency, Faisal Shoaib, described rotavirus as one of the leading causes of diarrhea disease in the world and responsible for over 40% of diarrhea in children. Dr. Walter Malombo, the WHO country representative, said Nigeria, being one of the 4 countries that harbor approximately half of the global burden, would gain from the economic impact of the vaccine. African health ministers have launched a campaign to raise awareness and strengthen prevention and care of sickle cell disease, one of the most common diseases in the region, receiving inadequate care. The campaign, according to the WHO Regional Director for Africa, Mashidiso Moeti, is intended to strengthen commitment as well as the financing resources for the prevention and control of sickle cell disease throughout the region. According to Moeti, the need to bring attention to this disease and help improve the quality of life for those who suffer from it has made the campaign extremely necessary. According to Moeti, the need to bring attention to this disease and help improve the quality of life for those who suffer from it has made the campaign extremely necessary. He called for increased investment, stronger collaboration and partnerships to help stem the tide of rising cases of sickle cell disease in Africa.
Hi, Kwandasta. Taron nan yayi yawa. Ya kamata ka je asibiti.
Asibiti? Ai ina zuwa asibiti likitocin nan yanzu ce mun za su yi. Wannan tarin na coronavirus ce.
Ina likitoci sun tabbatar cewa alamomin tari suna da bambanci a kowace cuta. Wani sai ka ji busasshen tari ne, wani kuma mai majina kamar irin naka.
Na faɗa masa, tarin wannan kwandasta nawa ya ƙi warkewa, kuma zai iya kasancewa tarin fuka ne.
Kwandasta, ka je a yi maka gwaji fa, don ka tabbatar, domin wanda bai je ba zai sani ba.
A bincike tarin nan don a yi maganinsa.
A bincike shi fa domin mu tabbatar.
Duk wanda ke tari har sama da sati 2 zai iya zama alamu ne na tarin fuka. Gwajin cutar tarin fuka da kula da mai cutar duka kyauta ne. Ku kira layin kula da cutar tarin fuka ta ƙasa a lamba kamar haka: 3340 domin samun ƙarin bayani akan inda za a yi gwajin. Wannan saƙo ne daga ma'aikatar kula da lafiya ta ƙasa da tallafin mutanen Amurka.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
Over 20 million Nigerians are said to be living with kidney disease, and no fewer than 20,000 of them are at the end stage, requiring dialysis or transplant to survive. I spoke with some medical experts to know the cause of the disease and the solution.
Chronic kidney disease is a long-term disease, kidney disease that prevents the kidney from functioning properly. Okay, so one of the risk factors is race. The people of that are of black origin, they tend to be predisposed to chronic kidney diseases. And again, age can be a risk factor. Previous history of chronic kidney disease, that's a previous family history of chronic disease, can be a risk factor of this. Diabetes as well is a risk factor of chronic kidney disease. Also, you see the high blood pressure, which is also prevalent among the black race, is another risk factor for chronic kidney diseases. So when people are lax towards coming to the hospital, they do not take their health checkups very seriously, they tend to eventually go down with chronic kidney diseases down the line. But generally, chronic kidney diseases present with symptoms blood in urine, feeling tired, swollen leg. So these are one of the symptoms to watch out for. Another risk factor for chronic kidney disease is glomerulonephritis and systemic lupus erythematosus. So these are conditions that affect children. So not everyone with chronic kidney disease engages in risky behaviors like cigarette smoking or alcohol, or maybe even had diabetes. Of course, if not taken care of, if not managed properly, could lead to chronic kidney disease or end-stage renal failure, as the case may be. People should generally create a culture of coming to the hospital to check their kidney function, to do a kidney function test, and make sure that their health are optimal. Because at the end of the day, if it gets to stage 5, it becomes irreversible, and that leads to end-stage renal disease, whereby the only treatment modalities is either undergoing dialysis or getting a transplant. I know dialysis is just to sustain. The best modality is, of course, to get a kidney transplant. So in general, people should take their hospital health checkups very, very important. The rural dwellers, they are mostly active when it comes to their daily lifestyle. They go to the farm, they walk around, and thereby they are not sedentary. So these people, another risk factor for chronic kidney disease is obesity. So these people are walking, they're engaging in physical activities, and thereby, preventing this part of the risk factor from becoming more eminent. Then, additionally, when it comes to the issue of dietary intake, these people, I think they are more careful when it comes to their salt intake. So, in the urban settlements, there are lots of fast foods where people can get foods that have high sodium on it, and then people are not even very conscious of the calorie and the nutritional intake that they are consuming on a daily basis. So when these people engage in this fast food culture, they tend to be exposed to these things, because you're not even counting the amount of salt that is being added to the food that you're consuming. But people in the rural setting, they are very, they do not have money to afford these things, so they are able to give an account of what they consume on a daily basis. But I want to appeal to everyone to take their health checkups more seriously. At least on a yearly basis, they should come to the hospital and get a kidney function test. In addition to a kidney function test, they should get a urinalysis and look out for the protein in urine to, be able to get this diagnosis done earlier.
Diabetes mellitus. So diabetes mellitus is the #1 cause of kidney disease worldwide. Another cause is hypertension. And these two alone contribute significantly to the large number of, the last data that we have is that over 850 million people worldwide have chronic kidney disease one way or the other. And a very large percentage of them, probably half of them, will be due to diabetes, while the other significant will be 20 or 30% of them will be due to hypertension. The other cause of kidney disease that is very common in our environment is infections. Various infections can cause viral infections from hepatitis, either B or C, can also cause even tuberculosis, can also cause kidney disease. Even our common infection like children having intestinal infections like diarrhea and co, person can eventually develop kidney disease later. So some of these things, if people are aware of it, and the other thing that I should mention is that also what we take in is also very, very important, especially people that ingest a lot of herbal concoctions, and such things can also affect the kidney. Also drugs. You see a lot of people patronizing roadside drug dispensers, and they will end up getting 3, 4, 5 non-steroidal anti-inflammatory drugs, which have been found to also affect the kidney. All sorts of things. The sad thing is that early stage kidney disease, most of the time, the patient or the individual will not be aware of what they are going through. They won't have any symptoms per se. The only thing is that the person may be fortunate to have maybe fallen ill and goes to the hospital and they run some tests and they'll say, okay, you have some affectation of your kidney, maybe the urinalysis was abnormal. They will tell you that and all, and tell you, okay, this is what you can do, maybe stay away from this, stay away from that. So that's the early stage. But once it becomes kidney failure itself, there are basically 5 stages of chronic kidney disease. Usually by the time it's stage 3, that's when you start having symptoms. Other things that you can have, and in that case, then that means that the amount of chemicals that the kidneys should wash away through the urine have accumulated in the person's body. When that happens, then you now start having other symptoms like vomiting, not wanting to eat, having the skin itching the person. Some may even develop symptoms that appear as if they are mentally deranged, like this. They won't know where they are, they may become unconscious, etc. Those things will happen, but those are symptoms of kidney failure. The kidney disease itself, in the early stages, you will not have any symptom. But you can have symptoms of a disease that is causing the kidney disease. For example, now if diabetes is your cause of kidney disease, you can have symptoms of diabetes, such as excessive urination, excessive drinking of water, weight loss, etc. You can have symptoms of complication of hypertension, which is also some other things. People that may have headaches from hypertension, from blood pressure being too high, then they'll come to the hospital and they'll see that their blood pressure is high, and that's what's causing the problem. For children, we think of infections. Infections are varied. It can be viral. For example, hepatitis, both B and C, can affect the kidney. HIV can affect the kidney. Other infections like tuberculosis, which most of the time is due to somebody having suppressed immunity from probably HIV or some other chronic illnesses. So infections too are very, very common in our environment, simply because our health system has not gotten to the level of advancement that of the Western world has gotten to. That if you compare transplant to dialysis, in the long run, you realize that transplant is cheaper than dialysis, in the sense that dialysis, by the time you do dialysis, the amount of money you spend, on average, let's say in a center, no matter if the center is even cheap, on average, a single session of dialysis costs about 25,000 naira. And most of the time, you have to do it at least 2 times or 3 times in a week. If you calculate that for a year alone, and the person would have to do it till the person leaves the earth or the person gets transplants. So that's the cost that you will get. In the long run, it will be more expensive. Consider transplant. In transplant's case, there's an amount of money you pay prior to, you need to evaluate your donor and you to see if both of you are compatible and if the donor is also fit to donate, etc. Subsequently, the money for the surgery is around 9 million naira for the surgery. But there are other things that would surround the surgery, like the tests that will be done prior to the surgery to evaluate, to make sure that the donor and the recipients are compatible, and also to make sure that the donor is fit to donate. That amount of money will probably run to around roughly around 1.5 million naira or thereabout. Subsequently, after the transplant has been done, as I told you before, the follow-up is even more important. There are drugs that they will be taking which are supposed to suppress their immune system so that their body will not reject the kidney that they've been given, because that kidney is not theirs, it's not their body. The body sees it as a foreign agent. So normally the body will want to fight it as if it's a disease. So we give drugs to tamper, to make sure that the immune system is not too active, so that it doesn't destroy the donated kidney. So those drugs are a bit expensive too. To be honest, my message to Nigeria is not even to the Nigerian people, it's to the government. Our government has to be responsive. There are countries in this same continent of Africa where they have made their citizens treatment for kidney disease free of charge. Some even give their people, their citizens money, those that cannot afford money, for transportation and feeding to get to the dialysis center so that they can have dialysis for free, and even transplant and all. So the government really, our government, we have a lot to do. We have a lot to do. An individual, no matter how rich you are, cannot afford kidney care. It is just too expensive. People have to sell their houses. People that are patients that have had transplant, many have to sell properties just to have enough money for these procedures to be done. It is just not fair that individuals are having to pay out of pocket for kidney care. And one of the ways in which you can actually fund kidney care is by making people aware, bringing the message to the grassroots, so that people are aware that taking these drugs, taking this herbal concoction and drinking roadside medicine, etc., can affect your kidney. If people don't know about this thing, they will continue to do it.
There are heavy metals called like mercury, cadmium, that hydroquinones containing creams, that people use, especially women who wants to be lighter. And when you use this over many years, it can also lead to kidney disease. And this is very rampant in our society. So when you see a lot more people coming down with kidney disease, these are some of the areas where they get the disease.
Yeah, just joining us is Health Affair on AIT. Next on the program is our nutrition segment.
It's a common saying that you are what you eat. This is why we make it a point of duty to give you information about food items, fruits, and their nutritional value to help you make healthy choices on our nutrition segment every week. We welcome adverts from food and beverage manufacturing companies on this segment.
Tiger nuts, also known as earth almonds, were one of the first plants cultivated in Egypt and traditionally used as both food and medicine. Tiger nuts are rich in a variety of nutrients and have been linked to several health benefits. Tiger nuts are rich in antioxidants, which are beneficial compounds that protect your body against aging and diseases like cancer and heart disease. Tiger nuts also promote digestion in various ways. Contents of tiger nuts are as follows. Calories 103 to 121 grams. Fiber 2 to 7 grams. Carbs 9 grams. Protein 1 gram. Fats 7 to 9 grams. Vitamin E 278% of daily value. Iron 13 to 40% of daily value. Phosphorus 9 to 11% of daily value. Vitamin C 2 to 8% of daily value. Magnesium 3 to 5% of daily value. Zinc 5 to 7% of daily value. Potassium 3 to 5% of daily value. And calcium 1% of daily value.
Please come with me to our clinical segment for tips on healthy living.
You should know your numbers. If you know the numbers, you'll be able to know this, my blood pressure is going high and all of that, And when you see signs that feels quite abnormal, then such an individual should come to the hospital and then get checked, you understand. It's not until something really drastic happens that you have to report at the hospital.
On our perception segment, we value your opinion on how to improve human lives and the nation's critical infrastructure.
The prevalence of mosquito is a reflection of our society. In a clean environment, we'll not be talking about mosquito. But I keep on telling people that Nigeria is a city of waste. At every nook and cranny, you dump waste, there's poor drainage system. And when the water is not flowing, those things form more like breeding sites for the mosquitoes. We dump everything at every nook and cranny, and they keep on revolving. So if you want to be serious with mosquito eradication, or maybe to eliminate it with a very appreciable state, we have to be very health conscious. It's public health issue. To eradicate mosquito, we have different measures you can use. You can use insecticide, You can use mosquito-treated nets. So many things.
This is where we wrap up the show today. Please join us same time next week for another interesting edition of the program. My name is Usho Mowa Daniels. Please keep staying safe.